goods imports and refugee camps in frontier counties. Mark Namaswa, KTN News.
The world over, midwives have taken a back seat as medics fight to contain the virus. But as they celebrate the International Day of the Midwife tomorrow, Timothy Otieno reports on just how much of a monumental role these medics actually play.
At the 30-bed capacity maternity wing of the Mater Hospital in Nairobi, nurses and midwives clock in for another busy day at the office. Among them is Eugene Mwai, a male midwife in an otherwise largely female-dominated field. He's been working at this facility for the last 2 years.
I'd say it's exciting. Midwifery is one of those fields where you get to, most of the time, have a taste of instant gratification on need basis of probably what your interventions are to the clients.
The interventions he's talking about include ensuring safe delivery of babies and protecting both mother and child from the deadly coronavirus. It's an effort made by the nurses and midwives here daily that mothers like Edith Mbira appreciate. Having safely delivered just recently, she admits things were a bit different this time round.
If you are visiting and you maybe don't have a mask, they will provide one for you before you see the visitor, the patient. And patients, we do get our masks every morning. So at least, and they take care to reduce the number of visitors so that the wards are not crowded at all.
I've delivered through cesarean section, although I've had the help of a midwife throughout from the first day I came kutoka asubuhi hadi sasa. They had to take me to theatre.
But the senior-most midwife in the facility, Teresa Mwaniki, will tell you it's not always a rosy affair. With very little personal protective equipment, the midwives who are celebrating the International Midwives Week say the threat of COVID-19 becomes ever so real every time a woman comes to deliver at the facility.
Midwives are also in the front line. As we talk about the other healthcare workers who are screening and those who are in isolations or quarantine places, let's think of midwives. They are actually in the front line.
You get mothers who are in active phase of labor. You cannot tell them, you don't have mask, I'm not going to help you. So we request all the facilities to develop a mechanism of how they can be able to handle the suspected cases of COVID and also the mothers with COVID, so that you can be able to protect the life of the mother and the baby.
The theme for this year's commemoration is Midwives with Women. Celebrate, demonstrate, mobilize, unite. It's a theme that has become a mantra to many of these medics, even in the midst of the world.